The sad loss of one of the world's great voices, Aretha Franklin, has served to highlight a little-known illness, neuroendocrine tumour. It's a rare cancer that's often misdiagnosed and has robbed us of not only the Queen of Soul, but Apple founder Steve Jobs. For some advice, let's bring in Dr Tamara Hunter. Hi, Dr Hunter.
Hi, Tracy.
How often are they misdiagnosed?
Well, neuroendocrine tumours, or NETs, actually arise from the cells that produce hormones in the endocrine system, or even some of the nerve cells. They commonly occur in the gut and are known as carcinoid tumours, or they can occur in the pancreas, even in the lung. Now, these tumours are quite varied, obviously, but they contain common cells and often produce chemicals and hormones that cause other symptoms. And this is part of the problem with diagnosis, is often they don't produce any symptoms, or the symptoms that happen don't point to the cancer. So, for example, a carcinoid tumour in the gut might produce serotonin, which causes flushing and diarrhoea. A NET within the pancreas might play havoc with insulin and glucagon, causing sugar imbalance. And even a NET in the lung can cause cough and wheeze, which presents like asthma. In addition to this, they're really rare tumours, 2.5 to 5 per 100,000 people, making up only about 3% of all new cancer diagnoses.
So how challenging is it to treat these tumours?
Oh, exceptionally challenging. Requires multidisciplinary management, surgeons, endocrinologists, often medical oncologists dealing with chemotherapy, and radiation oncologists. And in addition to that, the management of those carcinoid syndrome is really important too, and can actually present with life-threatening features.
And so what is the survival rate, and can the cancer be cured?
So survival rates are dependent on the stage of treatment and also the stage of the diagnosis and also the severity, and is measured as the number of people alive at about 5 years. Disappointingly, with pancreatic NETs, only about 14% of people with early stage disease are alive at 5 years, and with late stage disease, it's as low as 1%.
All right, Dr Tamara Hunter, thank you very much for your time this afternoon.
Thanks, Tracy.